Hey everybody, Robert here. Uh, do you know the subconscious mind can trick you? Yes. It does it quite a lot, but today we're going to be talking about how it does it in the world of pain, in pain control, because pain specialist. So, reading a book by Dr. Sarno. He's probably in his 80s now if he's still alive. He's an older guy, and he specialized in psychosomatic pain, or nowadays it's called neuropathic pain, nociplastic pain, mind body syndrome. Pick your damn terminology, right? But according to him, the subconscious can actually create pain where there is no injury as a distraction to keep you from understanding something that it thinks is too dangerous for you to know right now, or is too dangerous and it will create a problem in your life in some way or another that it cannot accept. So, examples of this are, well, random pains that shouldn't happen. Things like bending over and, oh, you tweaked your back, even though you've done the same movement your whole life. Why does this one change? Well, it could be a mind body syndrome issue. It could be your subconscious knowing that if it lets out a little bit of pain, a little bit of what it's been suppressing now in this moment, you will think it was the movement and not it. So you won't focus on it. Remember, it's suppressing something to keep because it thinks it's safer to do that for the moment. So it will create pain as a distraction. And another thing it will do is it will create pain in the site of areas that have abnormalities, like a bulging disc. That's one of the things I'm really reading about right now with the book is bulging disc. And according to Dr. Sarno, he did some kind of imaging studies and x-rays and such, and two-thirds of the people who he had in this trial or this whatever he did showed some kind of abnormality in the spine, bulging disc, herniated, whatever this, maybe not hernia, I don't know. But some of them talked about pain and some of them did not. Some of them had actual pain suppression and some of them did not. So, how are people with the same situation experiencing it differently? Well, according to Dr. Sarno, a lot of the things that are blamed, or a lot of the pain issues that are blamed on the abnormalities, are not actually abnormalities because people live with this all the time. It's a normal thing to see. So if it's a normal thing to see, why is it causing pain? And why is it everybody who has it has the same amount of pain? Well, the subconscious is very tricky. The subconscious is very intelligent. It's way more intelligent than you. It has all your memories. It stores everything about you and what you've been experiencing. And what it will do, according to Dr. Sarno, and I'm glad I know this now because it affects me, it will see a site or know about something in the body like a bulge disc. And it knows that if it creates pain in the area around it, that you will notice it. Oh, I need all this horrible pain. Go to the doctor, they get the x-rays and all that. It will show a bulging disc, so some kind of abnormality, and the pain will be blamed on that. Even though according to Dr. Sarno, things like this have a hard time causing pain or shouldn't be causing pain. So why is it? Possibly the subconscious is allowing or expressing pain in that area to kind of scream a little bit or just get a little bit of it out or express itself in it while it can because it's bubbling up with something. So there's that. It could create pain from a movement because it knows you might blame the movement. It could create pain in a site where typically you wouldn't have pain. Like that bulging disc could have been there for years, but it started to hurt now. That's something that's hard to tell. Not saying that a bulging disc can't cause an issue, of course. But according to this doctor, typically it's not the actual issue. It's something that the subconscious knows will get blamed, right? So the way that we look at these and change these is, well, engaging neuroplasticity, typically with somatic tracking and hypnosis. Those are the two things I use mostly for engaging neuroplasticity and changing the brain. Because pain is not only, you know, experienced, but it can be learned. And that's something with nerve pain and stuff like that, or phantom limb syndrome. The the brain, the mind, the body, what do you want to call it? The brain expects pain, so it creates the pain. And in these situations where you have, something like I was talking about earlier, where you might have pulled a muscle or something is hurting, even though it shouldn't be hurting, there's no reason for it to be hurting. Could be that. I'm not going to go any further, guys. I can go, 20 minutes on this easy, but check out the book by Dr. Sarno, The Divided Mind. I highly recommend it. It is great. I'm already certified in pain management. It's that one somewhere. But this book really expanded my mind a lot. And also, if you get a wild hair, check out a book by Dr. Vanderkolk, Bezel Vanderkolk. I can't remember his name because it's difficult to say, but it's called The Body Keeps the Score. These two books have really opened my mind a lot. And I think everybody should know what's in these books. Okay? These books are actually helping me develop my pain intervention even better. So, if you guys want to learn more, want to know more, have any questions, want to schedule a free consultation and talk to me about what I could probably help you with in the pain realm, check out Walt Hypnotherapy. There's a free consultation page, easy to do. And I have free audios up there for not just pain, but sleep and confidence. There's free stuff up there too. So check it out, guys. Have a great day.